Welcome to Inside Startup Investing, the only podcast where you can invest in every guest. On this episode, I will be speaking with co-founder and CEO of Assured Med Supply, Roy Malkin. Assured Med Supply is a medical purchasing software aimed at helping hospitals more efficiently procure the goods they need to serve patients. To be clear, purchasing things like gloves, IV bags, bed sheets, and more for hospitals is more than $1 trillion yearly market in the U.S. And anytime you have $1 trillion plus market, especially in healthcare, there's typically some fairly large inefficiencies to contend with. A few major things that stuck out to me about what this team are building are, first, purchasing the necessary goods for hospitals is an antiquated process that involves lengthy vendor approval processes and siloed information sharing amongst major hospital suppliers like Medline and McKesson. This leads to inefficient pricing for hospitals and can create challenges when a supplier runs into shortages of vital products like IV bags. In fact, when there are shortages from approved vendors, hospitals can be left canceling surgeries altogether or paying 2 to 10 times more for products just to get them delivered on time. Second, legacy vendors are not incentivized to collaborate and work with other vendors in the best interest of hospitals because the more they own the supply to a hospital, the better. Creating a streamlined solution that brings together access to information and supply flow across a multitude of vendors can greatly improve purchasing within hospitals, both from a pricing and timing perspective. Now for the challenging part. This is a business that is still in its early days and has a lot it will need to figure out in the coming months and years. Vendor approval processes are lengthy and arduous within hospitals. Driving purchasing change behavior will be an uphill battle, and making sure vendors continue to provide the necessary information for a middle software layer like Assured Med Supply may prove challenging. This is one of those companies I'd classify as being extremely challenging to build, but if they pull it off, it certainly does have a tremendous upside within such a large market category. So with that, let's get on to the show and welcome Roy. So for those who don't know, tell us what you guys are all about.
Yeah, sure. So we're essentially like a chat GPT for hospitals. Our company's name is AMS AI, also known as Assured Med Supply. We started originally with Assured Med Supply name, and we pivoted last year to AI. And so what we're doing is essentially a chat GPT for hospitals. We're helping the large US and then hopefully international hospital community save on supplies and kind of be an AI co-pilot for them on everything purchasing. That's first phase. Eventually, we want to go deeper into the supply chain and sort of do everything from being a marketplace for supplies. We have great experience with both AI and our team and marketplaces, and pretty much become a marketplace as well as a AI co-pilot. So I think those are very interesting things that could be very beneficial for the healthcare industry. And we worked directly with hospitals already for about 3 years already, and we know that's their pain point, and we're solving it.
So help me understand a little bit more of this pain point that you talk about. So when it comes to purchasing in a hospital, obviously hospitals are buying a ton of equipment, right, and supplies for throughout the hospital. How does that work today, and what problem are they running into that you're helping to solve?
Typical hospital manages about, I would say, 5,000 or so SKUs in different units. So they have, obviously, some of them buy $60 million of supplies. They're the largest hospitals in America, the top 25, buy about $600 million to $1.2 billion per hospital, not per hospital system, but per hospital, which is a gigantic system. So a lot of times, everything goes smoothly. So when things go smoothly, which is almost never, basically they get the supplies they need. But I would say about 20% or so supplies of any point of time is in shortage. So we're starting with that market. And the shortage of that market is where they scramble. They literally have to go in using Excel sheets or even like pieces of paper, calling all their vendors. Do you have this type of defibrillator? Do you have this type of vacutainer? And that has been very costly for these hospitals. Not only costly in the sense that they sometimes have to pay double or triple for the items that are in shortage, and that's a huge expense. So their number 2 hospital expense is supplies. So imagine suddenly you're fluctuating from paying what you usually pay to suddenly paying double or triple during a shortage. And I'll actually have a very specific shortage to talk to you about right now. I'll give you an example of that. Or when you basically have these shortages, you have to cancel procedures. And that's cost hospitals billions of dollars, way more sometimes than even the supplies. An example of that is, I believe you're, Chris, in North Carolina, correct?
Hmm.
And you obviously, unfortunately, faced that huge hurricane. Did you know that there was a big factory nearby you, near outside of Charlotte, I believe a couple of hours outside of it, they got hit, and that had 60% of the country's IV units. So you had, as a result, that factory was shut down or it couldn't supply the supplies. You suddenly have 15 hospital systems, so probably affecting maybe over 100 hospitals, announced that they stopped procedures altogether. They're elective. So that could cost people lives, not just like billions of dollars to them. And almost every other hospital, I believe, reported that they have a shortage of IV supplies. So that's IV bags, probably IV syringes and other things. So it's a critical kind of thing for hospitals to have these supplies in order to do procedures. It's just basic things. And during COVID, we've noticed like there was shortages of all sorts, and that actually continued. It's a myth that it didn't continue. It's actually continued. And for some hospitals, for certain supplies, it got worse.
So, with the technology that you've built, tell me how this solves for these shortage issues.
Sure. So the first things first is that if you're a hospital and you're looking for a supply, the first thing you want to do is find a substitute. So one of the way, right now, the system, the way it works is that it's sometimes very hard to find a substitute because a lot of the products actually come from Asia. They don't have the same, even though they're maybe FDA approved, they might not have the same packaging. They might have very hard ways to compare the specs, the specification of the product. So we help with that. You have suggestions. Some hospitals want to have a trade-off between, they're paying suddenly if it's a shortage item or not. They want to see if they're switching to something. Do they want to cut costs, or do they want to like pay more to get something faster so they don't miss a procedure, and so on. So we kind of partner with them through this AI tool, kind of like a ChatGPT literally interface is what we would start with, and then go deeper. Meaning you could go look deeper into the product, compare the specs, actually look into your financials. We want to plug in with an API into the financials in order to kind of optimize that through algorithms, what's most optimal to them. And as a result, we take that process. It could take them days or weeks. They're scrambling for product, and we could literally like hospitals that are suffering from this shortage in North Carolina, we could give them options like RFPs, create RFPs to 25 different vendors right away. And they're all vetted vendors. The vendors will have ratings, and algorithmically we could predict, well, if you want a product in one day, you could have these kind of vendors, but you pay maybe like double. Or if you have somebody, if you're willing to wait 30 days, you could have these vendors and you only pay maybe 25% markup if there's a shortage. But it's not limited to shortages. We could even do stuff that they buy on a regular basis, let's say nitrile gloves, which fluctuate almost like commodity markets. So if you spend any time working commodities, gloves are very sensitive to rubber prices and other things, shipping costs, like you have Houthis attacking in the Middle East, that could make the gloves go up 10% or 20%. And as a result, even the items that are not in shortage, but you get a lot in huge volumes, we could literally optimize with a hospital to save them a lot of money. But if you're talking about, if we could save even a few percentage points for a large hospital that buys $1 billion worth of supplies, I mean, we're talking about tens of millions of dollars savings per hospital, potentially.
No, it makes a lot of sense. Now, the way that it works today, I know of major names, right, like McKesson and Medline that are suppliers of products to hospitals and the healthcare system more broadly. So do they have a relationship specifically with certain distributors and suppliers? And then how do you kind of slot in? Does that hurt their relationship in any way? How are you kind of managing to be this middleman that has connections to more suppliers? And is there any impact with their current supplier relationships?
Sure. So we work right now, the way we're set up is to be an assistant to the hospital. So if they have a relationship with McKesson, I mean, generally you have a shortage, McKesson can't help you because that's, if you have a shortage, you're not getting the product. That means whoever your, relationship is with, that's not the one you want to deal with at that point of time. You want to figure out, hey, what's the number 2, number 3, number 4, number 5 vendor, maybe outside of your relationship that will work. What's interesting about hospitals is that they notoriously onboard other vendors very slowly because they're very careful So they don't have like a great vetting system, somebody providing them rating scores or anything else, especially if they're a foreign seller. So a lot of the factories, like I mentioned, like for gloves, 99% of them, or I would say 95 or so, are in like Asia. So you're going to go in and there's some famous names like Top Glove, but there's a lot of less famous names that are amazing, but no one would know. So it also helps with vendor discovery as well. But yeah, it lets them, like for the shortage part, it lets them go outside the traditional vendors. For even when they're dealing with a vendor they already work with, we work on the hospital side, so we could help them negotiate better deals potentially. If McKesson is like overcharging them or whatever it is, again, I'm not saying that they are, but they have multiple relationships like that. We could help them identify, well, from McKesson, you might want to buy a lot of gloves, or you might reduce the amount of Vacutainers you sell or IV fluids. So we help manage that and be their AI assistant, kind of. So we're on their side. And currently, there's no like, when they buy software, there's not a lot of software that's like on their side that's like really representing them. Because if you're getting something for free, especially, you're the product. So that like if in Google markets to you, so you get free Gmail, but they get a lot of information on you. So you're the product. So in one way or another, we hope to be very neutral, and I think that's why I think we have a competitive advantage, even if these bigger players come up with an AI program like that, and they're also selling them the supplies. You can't claim to be neutral. And you can claim to be on the hospital side because you're making a lot of revenue. You try to sell them the product also at the same time. So you're not going to be like trying to optimize and help them reduce their savings necessarily.
Well, you mentioned something interesting in there, which is that hospitals are notoriously slow at adding new vendors, are very careful. So I am curious on that in terms of if they discover a new vendor through your platform and they have a shortage, will they just immediately buy stuff from them, or do they still have to onboard that vendor? How does that work?
Sure. So the hospitals still have to onboard everyone they work with. I think that's their policy. We were lucky during COVID. The reason I think we have an advantage over a lot of startups is that during COVID, we operated like a traditional distributor. And so as a result, we got onboarded to so many amazing health systems. And no way a startup could do that, even if they had like 5 to 10 years worth of time to do that, because it's just not that type of quick onboarding is just not there anymore. But yeah, if they have a shortage, they're definitely going to fast track you for certain things. But they have to onboard you. They have to look, do the due diligence, even look sometimes at your product. If it's not like a very common one, you'll have to send them a sample. You have to submit some forms, and they have to look at it. There's some hospitals that actually would track your whole supply chain. So where, chain of custody, all the way to the factory, if you're a distributor, all the way to the, till the purchase point of delivery. So it varies hospital to hospital. There's just no, I don't think it's a very standardized system. Some, send you an Excel sheet to onboard you. Some of them have a system where you have to enter all your data and they automatically like vet you through, I don't know, Dun and Bradstreet or something like that. So it's not standardized. And I think that's their opportunities to standardize a lot of the processes that these hospitals have and save them a lot of money and time. And frankly, like just to summarize, I think an AI enabled hospital with one of our systems and programs will be competitive. And if you don't have AI helping you, just like almost any other company, you just won't be competitive because you're going to be buying products for 10, 20% than the other hospital. That translates to more expensive procedures, or it translates to you having delays. So imagine you're a customer, you go into, let's say Cornell Hospital, Cornell Hospital in New York, and you know that they charge 10, 20% more. Hospitals actually try to hide some of these, procedure fees, but, sooner or later, you'll see that it's a more expensive hospital, or you have to wait a very long time to have that procedure, especially if it's an elective one, because they don't have the supplies today to help you. And that's like a huge problem. So I think, these hospitals, if they want to be competitive, which they have to be, they will have to do this. They will have to be AI enabled.
How many vendors are you tracking? Because I imagine that the value of this service goes up as you have access to just, an unending number of suppliers for gloves or whatever the object may be.
Sure. So right now, again, I don't want to give away too much, but we have, as our client, you could see on our page, I'm not going to name the name, but if you go to our WeFunder page, we have the biggest, I think, supplier and health supplies in the world. It's like a $200 billion company. So we have that relationship. We not only there, we have a vendor relationship with them, but also we've supplied them stuff as well. So both when we were a traditional company, and we have a company called Siemens. We do stuff with them as well. We're an official vendor for them. They cover like, I would believe, thousands of different supplies. They're basically between that company that I just mentioned and Siemens. I think it covers, I don't know, maybe like $100 billion worth of supplies, more than enough than we could handle. But we also have a relationship with smaller vendors you've never heard of. So dozens of them, whether it's they sell syringes, whether defibrillators. I mean, I would say like 5,000 different type of SKUs. So we're well covered, but we're going to be onboarding them. I mean, just to be clear, right now we're trying to we're building a prototype to put into hospital hands for them to test and have a limited amount of vendors and maybe several, like about 4 categories and several hundred items within each category to make sure that, they give us great feedback and that specific things. And we train the data really well. The reason you need to train the data well is because hospitals have a higher threshold for accuracy than almost any other industry. If you send them the wrong product, you're going to get sued or you're going to be in trouble. So basically, it's not like even legal advice might be, there's a company called Harvey. They became a multi-billion-dollar company. That's what we're trying to be. We're going to try to be the healthcare for, like the Harvey for healthcare world for hospitals. And our market is actually bigger than even the entire legal industry. So, we think our prospects are very positive on that. But if the accuracy threshold is very, very high for hospitals. And basically, you need to be super accurate. And I think that's where our moat is. We want to combine pretty much, I think if we develop a system where we're training our data better and we have more accuracy, even if we started with limited amount of product categories, I think that's going to serve the hospitals to have trust in us. And then we could build on more and more categories as we go along. And I think the AI issue that everyone has, AI hallucinates, as you know. And so we're trying to limit that as much as possible. I don't think even the multi-billion-dollar companies are able to limit that yet. Even ChatGPT, OpenAI cannot do that. Microsoft, I mean, that remains a problem, but I still think we could limit it to a very small percentage of cases. And our system is not automated in the sense that we still would like to have somebody who is a real person, check. It's an assistant. It's not replacing people. So hopefully that's clear.
Where are you in terms of bringing this to market? Have hospitals utilized this yet? And if so, what type of feedback have you gotten?
So in order to put this product together, we met with several hospitals who already worked with us as vendors. We got their feedback. I mean, one of the things we were doing is gathering data, looking at, how they actually use the product and other products, And now we're putting it together. We're going to be ready by next quarter. To put it in, we want to put it in about 3 hospital systems' hands. They represent, billions and billions of revenue potentially in terms of how much product they buy. And for us, it's going to be the whole idea right now is to get feedback from these hospitals and then raise a much larger round. If you look at AI companies to get today, our valuation is about, I would say about 9 million pre-money right now. The average that I've seen is probably like 27 million before they do any line of code or have any customers. I think by the next round, our thought is like, well, we'll have obviously created a great prototype that's good enough for hospitals. We have hospitals testing them and giving us feedback, and we're ready to have the next round to scale it, because you need a lot of money to scale AI, especially if you're building something very very specific for hospitals that have high threshold for accuracy.
When you think about entering these hospitals and getting up and running with them, who's going to be the core user? Are there full procurement departments within a hospital? And is that where you're going to? What would that look like?
It's going to be procurement departments, the same departments we actually serve as a traditional company. However, interestingly, the buyer of it could be both the IT department, and I believe they have the similar budget as the procurement department. Some of these IT departments have $1 billion budgets to pay for us as a SaaS platform, and then the procurement department will definitely be using it. So we don't know if it's going to be the procurement, if it's going to come out of the procurement department's budget or it's going to be the IT budget, but either one works for us. Or it could be like a strategic budget, because if you might not know, but like a lot of these hospitals are already using AI in terms of surgeries and other things. So they're already on, in many things they have AI. They're pretty behind in this specific sector of purchasing supplies, and it's their number two expense after salaries. Salaries they can't touch. What's interesting about what we're targeting is that that's the one expense that varies. So it's a variable one, and they would love to cut it or improve it, and that's the one that kills procedures if they can't, if they don't have the supplies. Similarly, like if you don't have enough doctors, you can't do procedures. So it's a huge problem with them. We're solving. It's a real, it's not a candy problem. It's a tourniquet, really.
And in terms of the business model, how do you get paid? Is it just flat SaaS fee? Is there a percent on savings?
Yeah, so we can, people suggested us to do a percentage of savings. So we could look into that. Yeah, if we're saving a hospital $10 million, we might try to figure that out. But the thing is, like, you have to play around with the baseline. So in the first year, you save them, like, to say $10 million. Like, does that baseline shift, and how do you negotiate that? That could be interesting. But yeah, we would look into that. Right now, it would be as a SaaS model. So they would have pay per seat. So a typical department would, could buy 2-3 seats, could be in the thousands of dollars in the beginning, and then we might raise it depending on how much value we bring these guys. So yeah, if we're seeing $10 million, they'll pay, hopefully a decent amount for us to continue growing the product. And really, like, when they supply us data, we make their product better. So another thought we had was actually to have a model where we would get proprietary data from a lot of these hospitals that we work with, and in return, the data doesn't go outside of their like hospital network. So there's like 6 or 10 hospitals or 20 hospitals that use it, and they all get to benefit from the data. Kind of like the Hulu model, where you saw the studios kind of collaborate and have all benefit from Hulu existing. Actually, was a Disney at that time, so we interacted with that kind of deal. So I like that kind of model. So that's phase one. And phase two, when we move, and we believe we will do this, is when we move to a model where it also has not the AI copilot, but also like a marketplace where you could dynamically purchase things quickly, and both vendors and buyers could literally, and factories as well, could participate in that. I think we could charge like eBay, pretty much like a small percentage model. And there you could earn, quite a bit, because the transaction value we expect is probably in the billions. To give you a sense, we built a marketplace in my prior business. It's around tokenizing commercial real estate. It's really a marketplace of buyers and sellers. We have about $9 billion worth of AUM. We're in there, and we scale pretty quickly because we're offering a product that people really want. And so I believe here we started with a pain point that we learned from hospitals in dealing with them. And, it was very obvious to us that that's a huge pain point for them. And if we could provide them savings or a quicker service or an ability to act quickly in emergencies, that's huge. And by the way, this could be an existential thing for hospitals, because imagine you get into like a situation where there's like a war in Taiwan, which everyone is like talking about today. Like China, most people don't know that China could cut us off out of very critical medical supplies in one day. They could kill like millions of people because they're not going to get their medical supplies. In some cases, like China supplies like 70 to 90% of our healthcare supplies in certain sectors. So imagine like if our system and AI platform could be really pre-trained to kind of source these things to a different country, that's like to Mexico or I don't know, some other country that for specific supply, Canada, and we could do it quickly. I mean, we're talking about saving lives, saving hospitals billions of dollars, saving a lot of procedures from happening so they could happen. So this could be a almost like a structural thing that the government of US might want. So
when you think about scaling this business, do you think we'll start seeing revenues really come online in 2025, or is this going to take a couple of years to really kind of build out, heavily beta test, and start driving adoption in the market?
I think we could have revenues in next year, because I think that's a product people will want very quickly. It's just going to be a function of how many products we could add quickly, and how much. And for that, we do need to scale our team quickly. So that's why we would raise right away. As soon as we get good feedback, we show that to VCs or other investors, and we scale that. quickly. So we would have to really build the next version right away. And that's kind of where I am. I think hospitals are ready to pay for this today. Just like ChatGPT, people are paying it right away. It's like one of the highest products that, I don't know, the revenues are what, like 4 billion in like 1 year that they achieve, something like that. Again, obviously their market is everyone in America. Our market is specific to hospitals, but I believe they would want that even as a prototype. I think we could save them a bunch of money. Yes, they would want that. But I think in terms of valuation, if you're looking at it as an investor standpoint, there are many companies that are reaching today multi-billion-dollar status. They don't have barely any revenues or are not profitable. So that's around, I mean, our whole thing is to maximize the value for our investors. So whatever will maximize our market cap, like we would get, in the next round, more professional VCs hopefully coming in after this round, and they will guide us. And hopefully, some of them have expertise in AI. And our, situations, we want to maximize, Harvey, has decent small revenues, but they're valued at $2 billion. It's not even close to what the revenue is. So we would have to kind of manage that. And we would be very transparent with our investors in terms of which way we're going to go. We're going to build the product fast to get market share, or are we going to, do they find revenues to be most important? But a lot of my companies, almost every company I build we got revenues early. We've scaled in our own company from scratch. We went from zero investment. We went to 3 million revenue in the third year without any investment, outside investment. We're growing over 100% until we decided, look, we want to pivot. This is like a unicorn opportunity. Doesn't make sense for us to do this traditional business, but we have an opportunity to leverage a lot of these large customers, especially in hospitals, in order to migrate them to this.
I'll give you the last word here for those who are kind of on the line about investing. What's your last pitch to them?
Well, I think my last pitch is that we have a super experienced team that actually achieved revenue without any investment. And now we're seeking investment for this company for the first time as an AI platform. Our last business that we built, now manages $9 billion in assets, number one in the world in asset tokenization for real estate in the world. And so we have a good track record, and I think it achieved just under 200 million valuation in a very short time frame. So our thought is like, hey, we're gonna, hopefully lightning strike twice. And we want to build this into a ChatGPT for hospitals, and one that, not only, achieves potentially, hopefully, unicorn status at some point, because the market is huge. It's a $1.3 trillion market. And I believe that's the medical distribution market. It's going to go to $3 trillion by 2030. So it's growing super fast. The AI market, I don't have to explain to you people, it's growing super fast too. We're in the intersection of the two. And I think if you want to invest into a great company that has like a sticking point where hospitals don't really trade vendors like ours, if we could get in there, obviously we could make a huge impact. And finally, those people who are doing impact investors, we're going to 100%, if we grow big, we're going to 100% save lives. So even in the situation where you have right now in North Carolina, we could help more hospitals get IV fluids. That's like thousands of procedures we could save from make them happen. So that's going to save lives just as a basic math problem or a statistical problem. So if you want to invest into something that literally is going to save lives by helping hospitals go through with procedures and not end them, I think we're the business to do it.
If you like what you heard on the show today, you can check out why Assured Med Supply scored a 4.3 out of 5 at kingscrowd.com. You can now invest on WeFunder until April 30th, 2025. And please like, subscribe, and share our podcast wherever you listen to podcasts so more listeners like you can find us. Thanks for listening.